The All of Us research program is an ambitious effort to gather health information from 1 million or more people across the U.S. Researchers will be able to use this information to uncover new, more precise ways to prevent and treat disease and to keep people healthy.
When I came out, I didn't feel comfortable, I didn't feel safe, and that was a very hard place to be.
Coming out as lesbian, gay, bisexual, even now transgender, it was hard to do that. And so because of that, whenever you went in to see a doctor, you were too afraid to really actually say who you are.
The biggest obstacle, to be honest with you, and simply is this trust, right? Trust from the community on not being misgendered, not being mistreated.
The health community, healthcare, they didn't get that. At that time, they felt like everything is one fit. That no matter what happens to one community is going to happen exactly the same thing to the other community. And that's not the case.
The lack of data has been a major problem for a number of years. It's really only been in the last 10 years or so that the big health systems, the surveys that go out to people nationwide, have included any questions about sexual orientation, and only a handful of them have any questions about gender identity.
Oftentimes what happens, particularly within communities that don't feel safe within a medical field, is they'll prolong and they'll wait and they'll say, it'll get better, and then by the time they go to the doctor, it's so late.
My family has had issues like high blood pressure, diabetes, so I'm very mindful of that and really trying to do everything I can to resist that.
One of the things for me that I have to be careful of is, my heart. My mom died at a very young age, at the age of 43, of a heart attack.
What I really appreciate about All of Us is really taking this approach to make it inclusive of as many people as we can.
We'll have the information from 1 million people, people of color, LGBT people, people from diverse communities, to tell us about themselves.
To get their biological information into the database so that there's more information to work with when trying to develop new ways of treating people and treating those disease processes.
That's the only way we'll be able to find out and understand whatever that we need to do to take care of ourselves.
That's a call to be honest and open about being LGBT. It's really a much broader call to stand up and be counted. All of us being seen will give us hope.
Hello, welcome to everyone tuning in today to our All of Us online cafe. I'm Kelsey Mahaffey, the All of Us project director for 50 Forward, located here in Nashville, Tennessee. And today our topic is taking pride in health, why research on LGBTQ older adults is needed now. As most of you are probably aware, June is Pride Month. And so we thought this would be a great way to celebrate Pride and discuss this important topic. So with me today, we're going to have Dr. Tara McKay, Vanderbilt Assistant Professor at the Center for Medicine, Health, and Society, and Phil Cabucci, who is the Community Affairs Director for Nashville Pride, and Nancy Van Rees, a Metro Council member for District 8. So thank you all so much for being here with us, and a very special thank you to our guests that we have today. And before we begin, I just want to give some of you out there a brief overview. If you have not heard about the All of Us research program, I'd like to tell you a little bit about what it is. And this is a new initiative from the National Institutes of Health to advance precision. So we are seeking 1 million people from across the United States from diverse backgrounds. And the basic idea of how the program works is you enroll, you share your health data. Your data is de-identified from the researchers. Researchers study this diverse information, this diverse data set, and hopefully in the future, we'll be able to make better health discoveries and tailor our treatments to us as individuals. 50 Forward is a national community partner with the All of Us research program, And you can learn more about the program by visiting our website, which is joinallofus.org/50forward. So Phil, let's start off with you. I would love for you to give us some history around Pride. What is Pride? Why do we celebrate in June? And happy Pride to you.
Thank you so much. I'm producing this as well as talking to you live, so there's going to be a little bit of background noise that I'm trying to work out at the same time. But I was talking, I think what's really special about Pride Month is that it is an opportunity for our full community to come together and opportunity for us to celebrate across the age groups and a lot of different opportunities that we normally have when we come together in large groups. But at the same time, we're looking at things a little differently this year.
So when was Nashville Pride established? Was it long after the original Pride?
We are 31 years old. And so, yes, certainly a longer time than the original Pride, which was, we consider, between 69 and 70. So last year we celebrated the 50th anniversary of Stonewall. This year will be the 50th anniversary of the first Pride Parade in New York City. So for Nashville, this would be the 31st year.
Wow, that's fantastic. Yeah, that's a long time. That's longer than I realized.
Yeah, we've actually had some great success. And I think what's really beautiful about this is that over the last 30 years, we have grown in incredible ways. I would say that in the last 10 years specifically, our organization has sometimes doubled and tripled in attendance. And I think that's one of the most amazing pieces about this, is that we have these really incredible results every year, and we have more and more people that are coming out to support LGBTQIA plus people, but then also just being in support of the community as well.
And how was last year's festival? Did you all have record attendance?
We sure did. 75,000 people in attendance over our 2-day festival and parade. It was the first time in, I believe, 10 years that we had a parade, and it was right down the center of Broadway. It was a really special event, and we were planning an incredible opportunity this year with another parade, but obviously the pandemic aside, we had to change our plans a little bit. So we are absolutely looking forward to a parade of the same size, if not bigger, in 2021.
That's great. And I know a lot of people are missing that parade and that social interaction that is so wonderful every year. Do you have any recommendations on what people can do to celebrate Pride, even though they can't attend a parade this year?
Absolutely. I mean, there's a number of events that are taking place online, and you can do some comfort from home. Our productions locally with Nashville Pride, we are having a number of live streaming events that appear on Facebook and then YouTube as well. But then we've also partnered with larger organizations as well to have other initiatives that are taking place throughout this week, really, including Global Pride, which will take place on the 28th of this month, which is 24 hours of Pride celebrations from Pride organizations and entertainers from around the world.
That's fantastic. And for folks to find that out, they can just visit your website. All that information is there.
Yeah, they can absolutely visit the Nashville Pride website. Our Pride Live program takes place every Friday at 9 p.m. And streams on a multitude of platforms. And then we also have our Sing Me a Song event every Wednesday with musicians from around the country streaming and sharing their talents. So some really cool opportunities to be a part of, for sure.
That's great. I'm going to have to check those out myself. That's great. And one more question for you, Phil. I wondered if you could talk a little bit about the recent Supreme Court ruling that we had come out last week, and how does that specifically affect those that are in the LGBTQ community?
Well, I think it's a dramatic result, and it's something that's really exciting for every member of our community in however they identify. The opportunity to be able to go to work and be your full self and know that you're going to have the opportunity, potential to lose your job because of your identity is a really powerful feeling. I think it's one thing that we go away, opportunity to marry, but if you were married and then got married on over the weekend and then went to work on Monday, you would be fired, or you could be fired. And now you have full protections in that. But there's still a lot more work to be done in terms of ensuring equality for all LGBTQ Americans.
That's wonderful. Well, Phil, thank you so much again for being with us today and for also being our behind the scenes tech guru
Absolutely.
for us. We appreciate you so much.
Great. Thank you so much.
Okay, and now we're going to switch gears a little bit and talk to Sarah over at Vanderbilt. Sarah, I hope you can hear me okay. And you are the principal investigator for VUSNAPS, which is VUSNAPS, and that's the Vanderbilt University Social Networks Aging and Policy Study. So first off, can you tell us specifically about VUSNAPS and what it aims to accomplish? Sarah, can you hear me?
Hi there, I can hear you. Yeah. Are you guys hearing me? Well, so the VU SNAP study is aimed at older LGBT adults. We had the idea for this study a couple of years ago and had to go through processes of getting funded, but our main now older LGBT adults are using their social relationships, so their primary partnerships, their relationships with family, friends, coworkers, neighbors, and so on, to help them in terms of various kinds of activities. That might be everything from getting advice about like an emotional thing that's going on in your life, like if there's some upset at work or some upset in the family, who do you turn to for advice or for comfort, all the way to relationships that help you with coping with different kinds of emergencies. That could be health emergencies, financial emergencies, very acute kinds of short-term needs where you need help right now, just with like childcare, for example, or a ride to the doctor. And so we're interested in a lot of different facets of your people's social networks and how they help or maybe hinder people's health over time, especially older LGBT adults.
Great. And I was on your website and I was reading some of your findings so far, and it looks like you have discovered that LGBTQ Americans are at heightened risk of negative health and economic outcomes as a result of the coronavirus pandemic. Can you talk a little bit about that and why you think that is?
Absolutely. One of the things with this pandemic that we're seeing in a lot of different ways and coming to grapple with as a country and as, you know, society around the world is that this pandemic is exploiting inequalities we already know exist and exploiting vulnerabilities we already know exist. So, for example, we know that LGBT folks already have some of the health conditions that put them at greater rates than the general population in the United States. Those are things that might be related to immune function, like HIV, but there are also things like cardiovascular disease, asthma, those kinds of things that we pay certainly less attention to. We see higher rates of smoking, for example, in LGBT communities than in the general population, and that's coming out as a major risk factor for severe disease and complications should you get infected with COVID-19. We also see evidence that there's likely going to be greater economic impact for LGBT folks, and that's because we work in more exposed industries, like retail, like hospitals, like some of the other industries that have been closed down, education and so on. So there's greater likelihood for economic impact for vulnerable people and families. And LGBT families already started off in higher rates of poverty than the general population as well. So that's certainly a concern that we're not only already more vulnerable, but that the epidemic is going to push more people into that category. And then we also are interested in social impacts of the virus, right? Everybody's mostly staying home, and that affects our mental health and well-being, right? Feeling isolated is a big issue for a lot of people, and that affects people's other health behaviors and outcomes. So that's certainly an area that we're paying attention to as well.
Great, thank you. And like you know, our topic today is why research on the LGBTQ older adult population is needed now. Why is it that you feel that research on this specific community is so important?
I think this, research on this community is so important because we really haven't been paying attention. And we haven't, as like that intro clip for all of us demonstrated, one of the researchers mentioned, we hadn't been collecting this data. That's absolutely true. So we can't actually do anything about what we can't see, right? What we don't measure. And so it's been really hard. It's a hard fight, been a hard fight to get some of those questions, just the questions about asking sexual orientation or gender identity into some of those surveys so that we can actually see the gaps that exist and where we're failing members of our communities and what needs they might have. So this research is imperative to help us continue to identify those needs. This study is focused specifically on older LGBT adults who may have needs in specific areas like access to healthcare, like transportation, like supports in older age that we really want to focus on, highlight, and find ways to address.
Yes, what you say, I know, is so important, and we can all see the effects and the disparities that are happening right now. I read a statistic today, I think that members of our Black communities are dying at a rate from COVID twice as high as the rest of the population. And, you know, why is that? We need to know. So as a researcher, I'm sure you can speak to this about the lack of diversity in research. You know, a lot of our research has been done, I have heard many say, on the average white man. And so our healthcare is based on a system of one size fits all. So how do you see the lack of diversity, and maybe in the future, how would you feel about the need to include that diversity into research?
The inclusion of lots of different identities and experiences and diversity in research is absolutely essential. It's honestly the only way that we're going to see the needs that exist, the places where we're failing people, and also the areas where people are adapting and thriving in their environments. One of the things that we also hope to gain is a sense of how LGBT folks living in the South have made a life for themselves, have adapted to their environment, are using their social relationships to thrive and to live their best life despite the circumstances, despite living in a place that can often feel hostile to them and livelihoods, right? Certainly protections matter, and we can also see the outcomes of what happens when things like this Supreme Court ruling actually change people's lives. We can see more economic stability, years out. And so that's one of those things that we're really, really dedicated to. And the reason that inclusion matters here, so that we can show the effects of these policies as being positive, so that we can show where the gaps still exist and where we need more policy measures.
That's great. Thank you. And one last question, can you talk about, again, just who is eligible for the study that you all are conducting and how they can sign up, how can they get involved? And also, what specifically will they be asked to do?
Absolutely. So VU Snaps, our website is vnaps.com, and there's a link there to sign up and see if you're eligible. There's no responsibility after that. You want to see that you're eligible and not continue, that's fine. Essentially, we are looking for folks who are aged 50 to 76 and who identify as LGBTQ. This includes trans folks, non-binary folks, gender non-conforming folks. We are currently recruiting across Middle Tennessee. We're in several counties in Middle Tennessee, in Alabama, around Birmingham and Montgomery, and several counties in those areas, as well as in North Carolina, around Raleigh and Durham and Chapel Hill, that kind of Research Triangle area. So we're really trying to capture experiences across the South for older LGBT folks. Once you kind of enroll and see that you're eligible, you fill out a survey, but we are paying people to complete the survey. And they will follow up with you for the next couple of years and continue to pay you for surveys. And be addressing issues around social supports for older LGBT adults, as well as, since we're doing this now, right, we'll also be paying attention to the impacts of COVID-19 on people's social networks, on the things that they need, the gaps that they're experiencing in their everyday lives, the ways that people are adapting and thriving despite our current moment, and so on.
Okay, great. Thank you, Tara. And I hope that just with our current times, that this will encourage people to get involved in research, participate in your study at VU Snaps, go to the website, and also participate in other forms of research like the All of Us research program. So great. Thank you so much. I think now we have Council Member Nancy Van Rees, who I know is traveling and on the road, but she's been so gracious to call in, and I hope she's here with us today. Nancy, hello.
Okay.
That's not a car. You are in a home. That's great.
I am still in Michigan. We travel back to Nashville tomorrow. I am unfortunately at a family memorial. My mother-in-law, my wife's mother, died in May, and like many Americans, not being able to have memorial services was one of our challenges. To properly gather after self-quarantining to be able to get the family together. So it's been a unique situation that I know a lot of people are having to deal with, and I have empathy for. It was interesting listening to Phil talk about the early days of Nashville Pride. Of course, the first Nashville Pride was in 1988. Which was the same year that my wife and I met each other, actually a few months after Pride, but we'll claim the year. And it made me think about how those 30 years of Nashville and our experience has brought us into a situation to where even my relationships with 50 Forward in Nashville, that you think the people that put on that first Pride that were in their 25 or 30 are now getting into the seniors of our community, and it's an interesting perspective to have, and I'm happy to bring it.
That's great. Well, first, my condolences to you and your wife. I know that's hard with you up there, and I really appreciate you logging in and talking with us today. I wanted to ask you a little bit about PrideNet. So I know that you're involved in that, in the Pride study. And do you want to talk about that and how you got involved, and tell us out here what that is?
Sure. It seems to be survey day, so everybody get out their computers and take some surveys, right? So the All of Us research program with the NIH, when it launched, was able to have one of its located in Nashville at the 50 Forward location. And Kelsey asked me to say a few words, and I said, well, why don't we talk about this unique opportunity that all of us as a national program is including literally all of us, and to talk about LGBT research. And through that process, came in contact with a medical research program that had preceded actually all of us and continues today, which is kind of looped into all of us, kind of looped into the PrideNet for the Pride Study. Pridestudy.org is where you would go to sign up to take those surveys. It is a completely for the LGBTQ community, and we're looking for a more diverse out of Stanford University and the Southern California University School of Medicine, and an amazing group of people that has put together an ambassador program to kind of get the word out in different communities in different parts of the country. And I was, through all of us, looped into the PrideNet and therefore the Pride Study. So I've been able to kind of bridge those gaps between not only LGBT health in general, but also senior LGBT health, and being able to kind of communicate that. So as an out elected, the only one able to kind of talk peer to peer with some folks, I've been able to communicate through the National League of Cities and through the Victory Fund Institute to get information out to more out electeds, of which there are a little over 800, almost 900 out electeds that are learning about the program, to make sure that people know that both the research through all of us as well as the Pride Study is safe, it's reliable, and something that they can trust, which we know is whenever anyone's taking a survey, is their number one question, right? Where does this data go? How do I make sure that my identity is protected? And there's been so much effort to make sure that that happens, that I want to be one of the voices to be able to say that this can be trusted.
That's great. Yeah, I know you mentioned how this information does remain anonymous. And that's such an important point really to make, because it's probably, I imagine, one of the biggest hurdles is letting folks know that the information that they do give to the All of Us research program is de-identified. So what that means is essentially all of your personal information, your identifiable information, is removed from the samples that you give. So when the researchers are actually looking at the data itself, they're just seeing a bunch of numbers. They are not able to connect those dots and find your personal information. So that's such an important part. I appreciate you bringing that up. How have your personal efforts been going when you are out there engaging those in the LGBTQ community and in the older LGBTQ LGBTQ community. How has your response been from those individuals about participating in research in general?
Very good. I believe that we've all learned that it's really important to collaborate whenever possible. So very much like you and I have been able to collaborate with saying, okay, 50 Forward, how can we reach this community? In the same way, I've been able to challenge and help facilitate other organizations in different cities to be able to say, okay, you are a voice in the city of Dallas, or you are a voice in the city of San Jose. Who can you collaborate to make sure that these things are happening? And so I've been enjoying the thing that I enjoy the most, which is bridge building. And I think that if we continue to help each other with best practices, then we'll continue to see good results.
Yeah, I think so too. I love that. I like building bridges. Okay, last today, I know that Metro Nashville is entering phase 3 for our city's COVID-19 response. So I wonder if you want to talk about that, what phase, and any other updates that you want to talk about as far as Metro Nashville. You want to provide us with any information?
Well, I did myself a favor and tried my best to unplug last Friday. And so I did watch the mayor's press conference this morning to make sure that we were still up to date. And honestly, if you don't watch those, they are available on YouTube. So you can go back on Wednesdays and Thursday mornings now at 9:30 a.m. There's a press conference that allows updates. And we had 3 outstanding medical professionals underscore the reasoning behind going to phase 3, even though we're seeing some of the numbers go up. And a lot of it had to do with everyone's optimism that Nashvillians will do what we expect them to do, which is to wear a face mask whenever you're out, and to wash your hands. But particularly if you are going shopping or you're going to be around people, that mask is on to protect the person that you are with. And it's a form of respect to do that. I know that whenever I go into a store, or a restaurant, if I don't see the proper signage up that's required, if I don't see masks on by both employees as well as customers, then I turn around and find another place to go. And I think that if we kind of vote with our feet as well, it's kind of confusing to me a bit, because I think that, for a business to want to protect its employees and its customers seems like a no-brainer to me. For years, I don't know when it was, the most public health departments said, you're required to have, no shoes, no shirt, no service, all that. It's like no shoes, no shirt, no mask, no service. And it's up to the businesses to just say, we're going to take care of you by making this something that's required in order for you to be in here. And I think that if we, as Nashvillians, resiliently decide that that's how we're going to proceed in order to keep our economy going and in order, kind of keep things moving, then those are the things that we're going to be doing. Then this minimum of 4 weeks that we're going to be spending in phase 3 will hopefully work so that we don't have to revert, which would be devastating. I did want to mention too that we have, upon request of several organizations as well as myself, started a COVID-19 task force for 65 plus. And we'll be convening for the first time officially tomorrow. I'll be doing that one actually from the car. This is how I vacation. So that we can get together on the best practices for vulnerable populations, 65 and over, and those with pre-existing health conditions, which include a number of folks in our LGBTQ community, to have best practices on. It's like, well, I know that what's best for me is to do nothing, but I'm not going to do nothing. I still need to go out. So how can I do that? How can we encourage businesses so that whenever I call and I say, hey, I really want to take my mom out to dinner to her favorite restaurant. I want to make not just a reservation, but I want to let you know that we're coming. We don't want to wait. We want to go straight to a table that has conditions set up that's best for my elder guest. And so I think that's really good business, because if I'm a restaurant that caters to seniors at particular times of day with hyper diligent cleaning and quick service, then I'm going to win on that, because people are going to come to my restaurant. So trying to kind of build up those motivational best business practices to allow older Nashvilleians to be able to get out and about and feel safely doing it. We had a similar situation during the HIV epidemic. It was just the answer that they kept giving men was, okay, the best way to not get HIV is to stop having sex. And they were like, well, that's accurate, but it wasn't happening. And so it's the same situation where it's like, well, the best way to not get COVID-19 if you're over 65 is to simply don't go outside. Don't do anything. Just stay put. It's like, well, that's sort of accurate, but it's just not going to happen. And so having some of the best researchers from Meharry and from Vanderbilt and from HCA kind of on this study to be able to say, let's give best practices. Let's realize that someone's mental state is just as important as their physical state. And we have to find ways for people to be able to commune with each other in a safe way prior to getting the vaccine.
Okay, great. Thank you so much, Nancy. Thank you for being with us today and sharing all those important updates. We've loved having you. Have a safe trip home.
Thank you so much. I look forward to getting back.
Great. Okay, I think that concludes our topic today and our presentation. We would just want to thank all of you for tuning in and being with us today and learning more about taking pride in health and why research is important on the older LGBTQ community. Again, I want to thank my guest, Dr. Tara McKay with the VUSNAP study. You can learn more about that by visiting VUSNAPS.com, and that's the Vanderbilt University Social Networks Aging and Policy Study. That's one of our research studies we talked about today. We want to thank Nancy Van Rees, Metro Council for District 8, being with us, talking with us today about pridestudy.org. So if you want to find out more information on that, please visit them. And then we want to thank Phil Kabuchi so much with Nashville Pride for kicking us off and talking with us about Pride and the history and why we celebrate in June. It's been great to celebrate with all of you today. In conclusion, we hope that you've enjoyed this broadcast. We encourage you to visit some of these websites. These are great opportunities that you can make a difference from home. Simply visiting the websites, learning more about the research studies, and seeing if they're speak to you, if it's something that you would like to participate in. And of course, please visit the All of Us research program, which is joinallofus.org/50forward. That is our initiative with the National Institutes of Health, where we are seeking 1 million people from diverse backgrounds all across the nation to join with us, donating their health information so that we can get a better tool for researchers to bring us precision medicine or personalized medicine for our future generations. So you can learn more. Again, just visit our website, joinallofus.org. We're going to drop all these links in the comment box for all of these fine folks that have been here today and the different groups that they represent. Stay safe, Nashville, and happy Pride. Thanks for tuning in.
As a gay woman, I don't feel that the health industry has enough information. Usually when you go into the doctor's office, that's not something that you really expose. It's not something that's asked. So there's no way to collect that data. I'm an engineer, and I make decisions based on hard, objective data. And I want to be a part of a program like the All of Us program that collects this hard data to make decisions in the future and help others. I want to make sure that whatever I can provide, whatever information that you glean from me, helps someone like me or anyone else in the future. And I want to make a difference.